Hi, I am Dr. Suresh Kumar Panuganti, Lead Consultant, Pediatric Critical Care and Pediatrics, Yashoda Hospitals Somajiguda, Hyderabad. Today, let us see why children fall sick in winter. Winter is a pleasant weather for most children, yet as a parent, we need to be very careful because children tend to fall more frequently sick. They tend to catch cold, cough, which can persist for a longer period. Now, let's look at some of the causes of these infections or causes of these symptoms. Most often than not, we see a lot of viral infections because viruses tend to remain more active and potent because of the weather. Number one. And because of change in weather, if there is pollution, smoke and fog together forms smog, which can tend to get deposited in the lungs and airways of children. That can lead to recurrent allergies, recurrent cough, recurrent cold. And in those children who have childhood asthma, we see exacerbations or worsening of symptoms in this season. Sometimes we see worsening of symptoms more in the night. If your child has dry cough, recurrent cough, worsening of these symptoms in the night, probably your child is suffering from childhood asthma. Another important cause for these symptoms worsening in this season is pigeons. Pigeon droppings, pigeon feathers, they tend to exacerbate the symptoms. How do we prevent these children from these infections? Make sure your child uses a mask, especially when going to crowded areas, frequent hand washing, and eating freshly cooked warm food rather than stored food, and making sure your child is vaccinated up to date. If your child is not vaccinated against influenza or pneumococcal vaccine, make sure you consult your pediatrician and get it done, because any child who is vaccinated against these two vaccines, there is 80% chance of reduction in hospital visits as compared to those children who have not received vaccines. How do we take care of children's skin in winter? Children's skin tend to get dry, scaly, itchy. They tend to scratch. These problems are very common in younger children, but not necessarily limited to them. It can even happen in school-going children. So make sure your child is hydrated well. Make sure your child is using appropriate emollient or moisturizing lotion. And make sure your child is given a shower at least once a day with lukewarm water. And make sure your child is wearing appropriate dressing, especially full sleeves. And try to have some cotton clothes over which child can wear protective gear like sweaters or full sleeves dresses. The other important infection which tend to happen in this season is dengue. It is a mosquito-borne disease, easily preventable disease, because prevention from mosquito bites is almost equivalent to prevention of dengue. So make sure your child is not going to water bodies, and make sure you are closing the water bodies with appropriate lids at home, and wearing a full sleeves dress, and taking protective measures like mosquito repellent patches or even mosquito repellent other measures. Thank you.
Like, comment, and subscribe for more health updates.